Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we have an important health care update. First of all, we're going to take a look at the health of Pennsylvania's hospitals, and then, can you imagine this? Combating prescription drug abuse. A lot of good stuff. We'll be back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, we have an interesting show and an important show. It's one of our healthcare updates. We're going to have Dr. Karen Rizzo. She's the president of the Pennsylvania Medical Society on soon. But first, we have Andy Carter. He's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. Welcome, Mr. Carter. Andy, right? We do it.
Absolutely.
Andy.
Thanks
Andy.
so much, Terry.
Oh, it's great to have you. All right, listen. I read a couple of things about hospitals in the news. You're in the know. Rural hospitals, some closings, lots of mergers, lots of reorganizing going on in healthcare. One of the things that struck me is, and I like this personally, is hospitals are saying, well, you do something great over here, we'll put it over here in another hospital so you don't have to run. I mean, a lot of exciting stuff going on.
And I think a lot of it's driven by what consumers want out of healthcare. Yeah. They are demanding more from all healthcare providers, physicians, hospitals, nurses. So you're witnessing firsthand the response of the healthcare community to those growing demands. Not only do people want better quality, and they're entitled to it, but they want the best possible price.
Sure.
We as consumers want the best price, but so do the people footing the rest of the bill. Public payers like Medicare and Medicaid, as well as private insurance companies. So they're driving very, very hard bargains with all healthcare providers. So there's some response going on, and I can talk to you about how we're seeing that response.
Yeah. Now, we don't hear much about, rural hospitals, but, there have been some closings. Is that because you can now, the system is more efficient, you can deliver it in better ways? Is it... What's your sense about that?
I wish I could say that these closings were part of a deliberate and planned restructuring of the system. Some of these closings have been bad for communities.
Oh,
and
absolutely.
One of the reasons I'm interested in talking to people around the Commonwealth about how we have to achieve those efficiencies, but still continue providing services in rural communities. We have, for example, 13 critical access hospitals, and these by definition are very small, 25 beds. They face tremendous challenges trying to make sure that they can have qualified medical professionals on site to treat patients. That's hard to do. Let me tell you, it's made all the harder when people start trying to cut costs too rapidly. And a key example is the governor's budget proposal, which actually, for example, eliminates supplemental funding for those critical access hospitals around Pennsylvania.
Well, what's the alternative for people who live in these communities? Get in a car and drive? Is that the alternative?
That doesn't work.
I know it doesn't.
We need carefully constructed alternative systems that make sure that we have critically needed access, critical services in all communities around the Commonwealth. But we also have to recognize that in not every hamlet and every corner of Pennsylvania can we provide all services.
Right.
So we do need new partnerships between some of these smaller hospitals and some larger hospitals that can help provide services.
As I said earlier, I've been reading about that, and some of that seems to me to be good. I know there's some concern, will you become more impersonal? But I think if you have a critical heart problem and there's specialists somewhere, I mean, that, and the way you can transfer medical information today. I know when I go personally, 5 minutes later, my own family doc, he's got all that stuff. So when I call him, he's really up to date. That means a lot.
You're mentioning one of the key tools that we have available to try to improve access to care, electronic health records. Hospitals and physicians' offices are working furiously to get those systems in place so that that information can travel between providers rapidly. But that takes money. And that's why all the more reason it's important to maintain our financial commitment to these organizations so they can make those investments.
All right, let's run to a break. When we come back, I want to get into some of the budget details with you. I know this is important because it has to do with the livelihood and the ability of hospitals to be able to provide these important services. I want to talk in particular about something on a hospital tax that I don't know much about. You're going to help us out and help our viewers out. All right. I'm talking with Andy Carter from the Hospital and Healthsystem Association of Pennsylvania, and we'll be back after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to the program with Andy Carter. He heads the Hospital and Healthsystem Association of Pennsylvania. All right, you know, the governor makes his budget address. You've talked about one aspect of it, and then there's another consideration, and that's something called a hospital tax, which has to do with something that is very important to Pennsylvanians, Medicaid. You know, go ahead.
Yeah, well, the governor's budget essentially, from our point of view, essentially raises the tax that we agreed to pay 5 years ago and raises it substantially, 18%, to help balance the books. And we're very troubled by that step because it really takes a huge amount of resources out of patient care, takes a huge amount of resources, $130 million just for this increased tax, that we need to invest in electronic health records, that we invest in care across the Commonwealth. One of the reasons it's especially troubling is that hospitals are already under tremendous financial stress. The recent report out just reminded all of us that a third of hospitals in Pennsylvania in 2014 lost money on operations, and almost 30% lost money all told. So that's a sign of the stress that they're under. At the same time, they're increasing investments in community health.
Yeah.
So it's bad timing to try to take $130 million in additional tax take out of the pockets of these hospitals.
You also have consumers that I think are more knowledgeable than ever about the healthcare delivery system and probably a little more demanding. I mean, I know I am. I have a lot more questions than I used to have when I go to see a doctor or go into a hospital. I'm always, and that adds to the pressure for the delivery of services, I would think.
Well, consumers now have more skin in the game.
Yeah.
They're buying more high-deductible health plans, so they have to foot more of the bill.
Right.
So they're asking more and more questions, and that's appropriate, and we are working with them on that. But we're also being expected, appropriately, to take more responsibility for the health of communities. You know, Pennsylvania, for example, ranks something like 18th or 19th in the rate of adult diabetics. That's just too high for Pennsylvania to have so many adult diabetics. We have to work as a healthcare community to make folks healthier. And to the degree resources are being taken away from these hospitals, that impedes their effort to be as progressive as we should be.
You know, in many towns around this state, in many counties around this state, and I've mentioned this before, when I go out and talk to groups, I often talk about this, two big employers, education institutions and hospitals. Mm-hmm. And if one suffers, the community, I'm not saying you keep them just, you know, for that purpose alone, but obviously education and hospitals provide a badly needed service, but yet we often don't talk about jobs. We don't often talk about the investments they make into their communities, right?
Well, the hospital community is a huge driver for economic growth in the Commonwealth. You know, we account for directly and indirectly some 600,000 jobs across the Commonwealth and contribute well over $100 billion to the economy. And the governor's theme since taking office has been such ideas as jobs that pay. Mm-hmm. Well, we support that fully, and hospital jobs pay well. We need to preserve those jobs, not just for the sake of the jobs, but because we have so much to do to make Pennsylvania healthier. Mm-hmm. And so we're on that track. And there's plenty of transparency out there showing the public what we're doing in that regard, that we can be held accountable for delivering on the promise that we make every day.
Yeah, I mean, and particularly when you think of Pennsylvania and the great hospitals that we have, most of them, and I'm not picking on, located in some of the urban areas for obvious reasons. That's where the majority of Pennsylvanians live and access to them. I mean, some of the best hospitals, some of the best physicians, but we also have this big state, 12 million people scattered across a huge area of geography, a very rural state in many places, and that creates another healthcare, and maybe I can ask Dr. Rizzo, doctor shortage and all of that aspects of that lead to other problems trying to gain access to the system.
We share a commitment to being innovative in solving these problems.
Yeah.
We cannot continue providing health care the way we have the last 50 years. But what it's going to take is a vision and a strategy to get there. And a budget that basically just cuts and doesn't identify any new investments in targeted strategic tools is the wrong way to approach a budget.
Thank you for coming in. It was a wonderful update. I think we'll continue to follow this. All right, combating prescription drug abuse. Dr. Karen Rizzo joins me. We'll get into that and maybe talk about the physician shortage in some of the areas of the state. We'll be back after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Welcome back to the program. Dr. Karen Rizzo, she heads the Pennsylvania Medical Society. She joins me for what I think is a truly important subject. I'll call it combating prescription drug abuse. It's on the rise. It's important. It's costing lives every single day in Pennsylvania. Am I right about that, Dr. Rizzo?
Absolutely, Terry. In fact, the statistics from last year, 2014, show that almost 2,500 individuals died last year in Pennsylvania from overdoses. And that's about a 20% increase from 2013. So if you look at that on a daily basis, every day 7 Pennsylvanians died from a drug overdose.
Wow. So let's walk through this. So I go to a doctor, you go, you're a doctor, you don't have to go to a doctor, but let's say you go to a doctor, you get a prescription. You have a medical condition, you get a prescription. Is this the case for most of the abusers of this, that they don't follow the instructions, they take them not for the medical condition, but to get the high or to get whatever relief they think they need? Or is it a question where they get hooked? And after they get hooked, they find ways to get additional. Help me out.
I think both of those situations exist. The problem is the abuse potential for the product. And that's why with the new guidelines that the Pennsylvania Medical Society was very instrumental in helping develop for the state, helps doctors negotiate that whole process. It's important when a patient comes to you with chronic pain that you address that concern. Sure. And a history of physical exam, talking about the appropriate usage of an opioid if that's what's necessary. Are there alternate choices that should be tried first prior to going to a narcotic, should be discussed. And then if the decision is made to use the narcotic, which one, what's the dose, what are the potential side effects and long-term complications. And the patient has to be informed about all that as well as the potential for addiction.
Yeah, but the patient has responsibility too. I mean, it's a two-way street. The physician in terms of
Absolutely.
Of prescribing it, and the patient in terms of using it.
Of understanding the information, taking it appropriately, and not using it or overusing it is another concern. So an educational process has to occur, and then there should be follow-up following the starting of that product. And is the patient using it correctly? Are they overutilizing it? Are they mixing it with other drugs? These are all concerns.
And there's also this aspect you hear about occasionally where you start taking these and for whatever reason you abuse them, and then you move on to illegal drugs. You know, to who knows, perhaps even to the ultimate drug of choice for abusers, heroin, right?
Correct, and that is certainly a trend that is alarming and increasing. And being able to determine whether or not that behavior is happening is really the concern, because patients may not come back for the follow-up that they're instructed to do. They may move on to cocaine and heroin.
Yeah.
And then, now obviously we have another law that's passed in the state using naloxone to help in those situations.
Now what's naloxone? How perfect.
Naloxone is a drug that can be used to reverse the potential for overdose from cocaine and heroin. And it can save lives if used appropriately and timely. And in our state right now, there's a new law that allows physicians to prescribe it to law enforcement officers, to family members where there's concerns over, you know, potential abuse problems in their family.
Now you're a physician. How does the drug work?
Well, it's an injection, and it reverses the narcotic effect, the respiratory suppression that occurs with overdosing of heroin and cocaine. So
and there's something else that you talk about, and that's a prescription drug database. Is this a state database?
Right. The Pennsylvania Medical Society has been instrumental in getting that developed for the past 2 years. And finally, it's a reality. Because of some of the budget concerns that are still being worked out, it was scheduled to actually get up and running at the end of June of this year. That's likely going to be delayed, but the state is in the process of developing technology. And what that's going to do is allow prescribers as well as dispensers of narcotics a database. So when a patient comes in wanting a refill or claims they lost a prescription or are asking for a narcotic, they can query that database and determine whether or not the patient already got a refill a week ago or 2 days ago, is pill shopping, and looking for, you know, excessive narcotics.
Yeah. I'm chatting with Dr. Karen Rizzo. We're going to run to a break. When we come back, I want to ask about what do you do when you have these drugs but you no longer need them, plus the physician shortage in some areas of the state. We'll get to that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Welcome back with Dr. Karen Rizzo with the Pennsylvania Medical Society. We're going to move on now. Okay, Doctor, we have all these drugs. Everybody can open a closet and what's in there. Am I right?
Well, the problem is old drugs not being utilized, out-of-date drugs, and that's a concern. So the Pennsylvania Medical Society has initiated an effort to encourage people, especially with springtime and spring cleaning, to look at their medicine cabinets, to look at their closets and their bathrooms where they store these drug and see if they're no longer used to deposit of them. So the question is, how do you do that safely? And there are now drop boxes, if you will, in every county in our state. And there's a website that will show you where they're at, where you can safely get rid of your old or no longer necessary narcotics.
If you Google prescription, what it would be, prescription drug drop-off, you think you could find it that way?
Yes, or just go on the Pennsylvania Medical Society website.
Google Pennsylvania Medical Society, get on. I mean, I know in our own house we have them there, and my wife says, well, don't put them down the drain, you know, we don't want them in the water supply, and if you put them out, you don't know what will happen if you put them, you know, send them out with the trash. All right, I want to get on to an important subject. Rural health care. Physician shortage, not just in rural areas for family docs, and specialties in rural areas and even in some urban areas. What's going on?
Well, a recent survey looked at our manpower issue, and depending on where you are in the state really determines if there is a physician shortage. In urban areas and suburban areas, there seems to be an adequate supply for most. In the rural areas, there's exception, as you would expect. So the question is, what do we do about that? And we feel that this may be an opportunity for where telemedicine can start to be an influence. And the Pennsylvania Medical Society is currently drafting legislation that will be addressing telemedicine, how we can use it, how we can help rural access to health care with video conferencing.
Okay. Now, there are a couple of other things that could be done to attract physicians.
Absolutely. And the governor has this on his plate with some of his budget proposals as well. We're asking to increase the amount of medical student loan debt forgiveness, which would perhaps entice medical students when they do their residency to stay in our state. If they go to underserved areas where physicians are needed, they would get loan forgiveness. And that's becoming a more attractive option, especially for primary care. And we have
lots of doctor preparation training in this state, don't we? I mean, it's a huge part. And
absolutely. We have 9 medical schools.
And they leave the state. Too many of them.
Too many do. That's the problem.
I'm with you on that.
And what we're also trying to do is start targeting students in high school and in college about healthcare careers and trying to promote more interest at that level in becoming a doctor or a nurse to help, satisfy this pending shortage as we move forward into the future.
Right. So all of this is not quite in place yet, but it's you're in the process of implementing that?
Depending on where you are in the state, there are programs that are already being started. Pittsburgh in particular targets high schools where they talk about health careers to students in high school and try to increase awareness and potential opportunity.
Yeah, having spent all of my life in higher ed, and Franklin and Marshall, where I'm a professor, we have a great track record of sending people on to medical school, as do some other, colleges, many other colleges in this state. But the problem is the length of time and the cost. Length of time to become a physician, and then the cost of it really gets quite almost overwhelming, doesn't it?
Absolutely. The average debt load is still anywhere from $150,000 to $250,000. So that's a major concern for when medical students are finishing. It impacts their residency choice because that influences the finances with all that.
Well, look, I want to thank you. This is a great update. I think you've helped us all understand a little more about what's going on here. You'll have to come back and give us an update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.